Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. Let's talk about elbow pain, so stay tuned. Thanks for watching. Let's talk about elbow pain. What causes elbow pain? Well, short of activities that actually injure it, like if you hit your elbow and you break your elbow, that type of situation. There are conditions called lateral epicondylitis, tennis elbow, or golfer's elbow. You know, you might have heard about those things. Essentially, it talks about, or it's a elbow joint issue. So we want to be talking about essentially movements that have to do with this. So what we want to, that's essentially it. So if you're having an overuse of the elbow joint because of the activity you're doing, or unfortunately in most cases these days that I see in my practice, it has to do with actually sitting behind a computer where your elbow is sitting at the edge of your desk. So I'm going to come up here a little bit. So if this is your desk, your elbow is sitting there and it's actually pressuring it, so you end up having issues there. Most of those elbow conditions have to do with actually the muscles in your forearm. So you want to be careful, because a lot of times the diagnoses are given to you that are not necessarily true. So be careful with that. One of the things you want to do is, at least in my practice, what I do has to do with working on the muscles in your forearm, which and actually the attachment of your triceps and biceps to the elbow joint. So it's the surrounding muscles that need to be worked on. There are a lot of trigger points there that need to be worked out. And I like active release technique or functional rehab, where the actual joint is or the muscle is worked. So depending on what muscle you're working on, you make that muscle do its work while you're finding the sore spots, which is the source of your trigger points, and you apply pressure there. So a lot of times moving the forearm in a twisted fashion, in like screwing light bulb, unscrewing the light bulb type of situation, supination, pronation type of movement is going to help you quite a bit with your elbow pain. So many times the actual elbow pain is not a problem in the elbow, but it's radiation of pain from trigger points in the surrounding musculature. So like I said, a lot of times because of the sedentary lifestyle, it's actually the forearm that is an issue. So make sure that your elbow is not sitting at the edge of your desk, compressing the joint and the nerve, the ulnar nerve coming down here and causing some issues there. And because you start there nice and flat, and then as the day goes by, you start sinking into your chair while the pressure is applied here. It causes a lot of issues, one of which is the elbow. Anyway, hope that this helped. If you have any questions, don't hesitate to contact me in one of the methods of contact at the description box, and I'll make sure I'll put in. And subscribe to my YouTube channel, where you will get a lot more videos on different subjects that have to do with your health. And follow me on my Facebook page, Irvine Spinal Wellness Center. Thank you for watching. Take care.